Hello everyone, myself Dr. Anjali Abhijit Deshmukh, Director of Asta Surgical and Maternity Home, Secretary of Amravati OBGYN Society, Maharashtra. Today I will speak on topic cervical cancer. So, as we embark on the journey of women's healthcare excellence and women empowerment, let us spread awareness about cervical cancer among women because I think this, this awareness among women and these knowledgeable, enlightened, and mindful women will only spread awareness amongst their friends, will be a source of inspiration, guidance, and healing hands not only to their family but also to the entire society. So, let's talk about cervical cancer. Today I will talk from its incidence, then causative factors, prevention, diagnosis, and treatment. So let us know about its incidence. The incidence of cervical cancer, it ranks on second place next to carcinoma breast. The mortality rate of cervical cancer is more than 50% because it is diagnosed in second and third stage. In every 4 minutes, one woman dies because of cervical cancer. 7 women will die of cervical carcinoma during my presentation. So till now, you must be knowing the horrible condition of this carcinoma. So what are the causative factors? The causative factors are HPV infection, poor hygiene, then unprotected sex, having multiple sexual partners, then immunocompromised patients. The other factors are obesity, infertility, prolonged use of oral contraceptives, then late menopause, and smoking. So what are the symptoms? Symptoms are white discharge. It may be foul smelling white discharge, then irregular and prolonged bleeding, postcoital bleeding, postmenopausal bleeding, pain in abdomen, then loss of appetite and loss of weight. So how you will diagnose this cervical cancer? The diagnostic tests which are available are cytology, which are pap smear and HPV DNA test. These are the cytology tests. The pap smear should be done once in 3 years and the HPV DNA test should be done once in 5 years. If there is any abnormality in this test, then go ahead with colposcopy. In colposcopy, we study the detailed cervical tissue. Where the colposcopy is not available, you can do visual test known as VIA, that is visual impression with acetic acid, where the cervix is stained with diluted acetic acid and the changes are seen. If there is any abnormality in these two tests, that is colposcopy or VIA, then further treatment is advised, like targeted biopsy from the abnormal area is taken or cryotherapy or loop therapy is advised. So how you will prevent this cervical cancer? This is only cervical cancer which is preventable by HPV vaccination. WHO recommends HPV vaccination in early age of girls, that is 9 to 14 years. The main vision of WHO is to make global a world free of cervical cancer. So it recommends HPV vaccination in girls 19 to 14 years. The 2 doses are required at 0 and the first dose is at 0. and second dose after 6 months. Why WHO targets these girls at young age? Because the immunity is highest in this age and the girls are vaccinated prior to their first HPV exposure. Then the girls from 15 to 45 age women can also be vaccinated. 3 doses are required, 0, second dose after 2 months and third dose after 6 months. There are two vaccines available, bivalent and quadrivalent. Bivalent are against 2 strains and quadrivalent are against 4 strains. So it is good to opt quadrivalent vaccination. This HPV vaccination is safe, effective, having no serious side effects. It is given intramuscular, in deltoid, and it is an OPD procedure. Nothing to worry about this vaccination. So, you have seen that this. So, join hands, spread awareness. Don't let cancer stop you. It's time for you to stop cervical cancer. Science is clear. Hope to cervical cancer awareness is there. So let's eliminate cervical cancer. Thank you. Now let me tell you that it takes about 10 years to show the signs and symptoms of this cancer and other 10 years to develop into cancer. So in this first 10 years, if you do these tests, that is pap smear, HPV DNA test, colposcopy, the cancer will be diagnosed in a very primitive early stage in which are pre-invasive, and in this stage it will be completely cured. It is completely curable. If you miss this first 10 years and in next 10 years it will develop into carcinoma, that is stage 2 and stage 3, where the mortality rate is very high. So be careful, go ahead and get yourself diagnosed in these first 10 years. So let's join hands, spread awareness. Don't let cervical cancer to stop you. You stop cervical cancer. Science is clear. Path to cervical cancer elimination is possible. Hashtag she lives cancer. So let's join hands, spread awareness. Don't let cervical cancer stop you. It's time to stop cervical cancer. Science is clear. Path to cervical cancer elimination is possible. So happy Women's Day, friends. Hashtag she wins cancer. Thank you.